Okay, welcome to this video where we're going to discuss how long cocaine stays in your system when we are looking at this in regard to drug testing or drug screening, particularly if you've been called for a workplace or employment or pre-employment drug screen. We're looking at various membranes for you as well to discuss the common membrane tests which are used in testing as frontline or first-line screens. Now, these will almost invariably be either a saliva test, such as this one shown here, or a comparable urine test, and the one we're going to demonstrate for you here is the all-test cocaine test cassette. The urine and saliva testing sensitivities are very different, and the window periods for detection in terms of how long cocaine will remain in your system and be detectable by these methods again is quite variable depending on the type of test used. Saliva testing offers the shortest window for detection, i.e. the shortest period after which cocaine has been consumed to which the test results would start to appear negative, i.e. the body levels in the saliva being measured fall below the cutoff for a positive test indicating result on a saliva test, usually within 24 to 36 hours. And most of these saliva membranes will screen a saliva level of 20 nanograms or above. So that is quite a short window period after cocaine has been used for it to be detected during a saliva test. And these tests are far more appropriate to be used either for employment screening, where they're doing a post-incident or accident screen to exclude cocaine as a cause of development. A roadside test where they're looking to see if cocaine is active in somebody's system and going to be pharmacologically still active while they're driving, or as a forensic screen in healthcare where you've got somebody presenting with acute mental health issues where again cocaine wants to be excluded as a possible causative agent. Compare that to the urine screen shown above. These will traditionally work to NIDA and SAMHSA cutoffs of 300 nanograms. Now, while that seems much higher than the comparable saliva level, that will give you a period of detection after cocaine has been used of up to 5 days. And only after 5.5 to 6 days will the test revert to a negative result. So that's quite an extended or longer period for a urine test, and that is why most pre-employment screens will still be performed on a urine sample as opposed to a saliva test. So what we're going to show you now is the performance of a test on a urine sample using the top test here, which is the all-test cocaine test DCO 102. This is a standard 300 nanogram membrane supplied in a foil pouch with desiccant and a pipette, which is used for adding the sample to the test. For the purposes of this demonstration, we're just going to add a water sample into the sample well. 1, 2, 3 drops. Should be all that is required, and you'll see that test running with pink dye running up the test window area, clearly marked COC on this cassette, indicating the abbreviation for cocaine. Now, the sensitivities for cocaine urine testing can be lowered to 150 nanograms. That test is available. That doesn't really extend the window period of detection by any great amount. You're still going to have a window of detection of up to 5 days even on a 150 nanogram membrane. Here you'll see that test runs within 30 seconds. You've got a clear negative result, as you'd expect on tap water. Obviously, there's no adulteration test or anything being run on the sample, which would be an idea to do if you had any doubt about the chain of custody of your urine sample collection before you run these tests. But that will give you a detection window or a period over which cocaine will show in the system of up to 5 days. Compare that to the comparable saliva test run here. Now, this is a multi-panel, but on this test is the COC membrane at 20 nanograms. Of as little as 24 hours detection. So first line for most screening programs will be a urine test. The alternatives, which will not be performed routinely unless you're under high suspicion, would be a hair follicle examination. Now, hair follicle examination can basically be determined by the contract that's set up for the analysis of that hair follicle, but most will default to a 3-month basal segment of hair, looking back for deposition of cocaine and its metabolites in that hair follicle for a full 3-month period. But the costs involved with doing that analysis really are punitive for most pre-employment and employment workplace screens, which will almost invariably rely on one of the two methods we've demonstrated here.